nursing. Then we solve NCLEX questions, and we will do Kahoot at the end. Now, firstly, let's watch about psychiatric video.
We can't see the video.
Yes, I will open.
Yes.
I've just started working here and it still feels unreal. There are people with unusual behaviors and I'm not quite sure how to react. I feel very sad for them because mental illness actually makes them unaware of how they are behaving.
I'm not crazy, you know? You are crazy, you are crazy! I'm not crazy! Right now. All of you are crazy! I want to get out of this place!
This patient has schizophrenia, maybe one of the most common illnesses. It's really quite hard to understand them and knowing what their world is like. To be honest, I have no idea what he wants or how to deal with it. When I was attending this peer response course, I seriously didn't think that I would be able to use the skills, but hey, I did have to use in the ward to help a patient.
Let me go! Let me go! I want to go home!
There are a variety of courses available, such as the closed-loop medication management system technology and counseling courses to equip the nurses with knowledge needed to provide patients with the best care possible. Some medication is actually not as difficult as I thought. Of course, it's not giving them the medicine and water, but it's also ensuring that it's the right patient with the right medicine. Even though understanding them is not easy, I'll try to be their friends and help them get better. Give up, sir. Let's do this. I guess nature has a part to play in the recovery process. I feel great just seeing them getting better. I wish if they really have. Whenever I mention that I work in IMH, they always give me this weird glance. What the IMH is?
IMH?
Yeah, I'm a psychiatric nurse there.
Oh, anyway, my niece just admitted in IMH. Thanks for taking care of her.
Don't mention it, uncle, it's our job. Come to realize that being a psychiatric nurse is not just a normal nursing job. It is a specialization within the nursing community. It is a job that requires extra care, independence, and understanding. Mental illness can be difficult and chronic to treat. However, with the right medication and treatment, many patients can resume normal lives. To me, my job is a journey that is filled with adventure to comfort those that cannot help themselves. Seeing my patients having a life after IMH, I just feel happy for them.
Yes, now it's time for the presentation. Page 2. Yes. Psychiatric and mental health nursing. Psychiatric nursing or mental health nursing is the appointed position of a nurse that specializes in mental health and cares for people all of age experiencing mental illnesses or distress. These include schizophrenia, schizoaffective disorder, mood disorders, anxiety disorders, personality disorders, eating disorders, suicidal attacks, psychosis, paranoia, and self-harm. In this area, receive specific training in psychological therapies, building a therapeutic alliance, dealing with challenging behavior, and the administration of psychiatric medication. In most countries, a psychiatric nurse will have to attain a bachelor's degree in nursing to become a registered nurse and specialize in mental health. Then is page 3. Please. Thank you. Degrees vary in different countries and are governed by country-specific regulations. In the United States, one can become a RN and psychiatric nurse by completing either a diploma program, an associate's ASN degree, or bachelor's BSN degree. Mental health nurses can work in a variety of services, including child and adolescent mental health services, CAMHS, acute medical units, AMUS, psychiatric intensive care units, PICUS, and community mental health services, CMAHS. And now questions. And question 1. A patient is prescribed sertraline for the treatment of depression. Which of the following common side effects of sertraline should the nurse include in the patient's education? A. Chills. B. Constipation. C. Tremor. D. Weight gain. And answer weight gain. Explanation. Sertraline Soloft is a selective serotonin reuptake inhibitor, SSRI. Common side effects of SSRIs include weight gain, sexual dysfunction, nausea, headache, dizziness, drowsiness, insomnia, and dry mouth. Incorrect. Dream or chills are symptoms of serotonin syndrome and not common side effects associated with SSRIs. And question 2. When a patient is admitted to psychiatric unit, they proclaim, "I am the Duke of York. How dare you touch me?" This is an example of A. Delusion of reference, B. Delusional parasitosis, C. Grandiose delusion, D. Persecurity delusions. Answer grandiose delusions. Explanation. Grandiose delusion is when a person is convinced he or she has special powers or abilities or is a famous person. And question 3. Which of the following will require careful monitoring for a child with attention deficit hyperactivity disorder, ADHD, taking methylphenidate? A. Dental health. B. Excessive appetite. C. Height and weight. D. Mouth dryness. And height and weight. Because carefully monitor growth because methylphenidate may decrease appetite, causing weight loss and late growth in childhood. Studies have shown, and there are no associated changes in adult height for those treated with stimulants in childhood. Question 4. A client with schizophrenia has been admitted to paranoia and disturbed thought process. The nurse should instruct the staff to take which action? A. Avoid laughing near the client's room. B. Begin client educational about how they can help. C. Encourage socialization and communication with the client. D. Treat the client normally. Answer. Avoid laughing near client's room. Because a client with paranoia will often assume bad intentions from those around them, whether outside of the room or among staff, while in the client's room may disturb the client. The client may interpret the louder as being directed at them. Idea of reference. Question 5. A patient with antisocial personality disorder is admitted to the unit. Which of the following actions is the most therapeutic for this patient? A. Administer antipsychotic medication. B. Examine personal feelings toward the patient. C. Instruct the patient to solve problems in a healthy manner. D. Tell the patient to obey all unit rules. Answer. Examine personal feelings toward the patient. Explanation. The nurse should examine personal feelings toward the patient. Patients with a personality disorder will sense negative feelings from the nurse, and this could negatively impact the nurse-patient relationship. Question 6. A patient has been started on valproic acid for the treatment of bipolar disorder. The nurse should instruct the patient to do which of the following? A. Notify the physician if you become pregnant or if you are planning on becoming pregnant. B. Stop taking the medication if you experience headaches. C. Stop taking the medication if you experience weight gain. D. Use a generous amount of sunscreen to avoid photosensitivity. And answer, notify the physician if you become pregnant or if you are planning becoming pregnant, because valproic acid is in pregnancy category D and has been linked to birth defects. Question 7. The nurse is caring for a patient with post-traumatic stress disorder. What are some typical symptoms the nurse might expect to see? A. Difficulty concentrating. B. Flashbacks to the events. C. Lethargic behavior. D. Nightmares. Answer, there are 3 answers, A, B, D. Because generally patients with the post-traumatic stress disorder are hypervigilant and anxiety-ridden, not lethargic or lazy. Common symptoms include an inability to sleep, re-experiencing the traumatic event, anger, and general avoidance of any stimuli relating to the event. Post-traumatic stress disorder sometimes occurs when an individual is exposed to a traumatic experience where they feel helpless and horrified. Question 8. The nurse is caring for a patient who is diagnosed with antisocial personality disorder. The patient has a history of fighting, cruelty to animals, and stealing. Which of the following traits would the nurse be most likely uncover? A. Low tolerance for frustration. B. Frequent expression of guilt regarding antisocial behavior. C. History of auditory hallucination. D. History of gainful employment. Answer, a low tolerance for frustration. Because patients with antisocial personality disorder exhibit a low tolerance for frustration, emotional immaturity, and a lack of impulse control. And question 9. A patient diagnosed with depression is interested in smoking cessation. The physician would most likely prescribe which antidepressant that also aids in smoking cessation? A. Bupropion. B. Mirtazapine. C. Nefazadone. D. Trazodone. Answer, bupropion. Explanation, bupropion is a norepinephrine dopamine reuptake inhibitor NDRI used to treat depression, adult ADHD, and nicotine addiction. Bupropion activities the dopamine receptors in the nucleus accumbens, the reward center. And last question. In which stage of separation anxiety does a child act sad and apathetic? A. Despair. B. Detachment. C. Dissociation. D. Cytocism. Answer, despair. Separation anxiety generally occurs in children between the age 8 months and 3 years. Hospitalization can trigger this anxiety as a parent may be away from the child for long periods of time. The 3 stages of separation anxiety are 1. Protest, Crying and making a sign, the child will usually refuse comfort from anyone but the primary caregiver. This can last for days, with the child only sleeping when exhausted. Older children may be aggressive or uncooperative. 2. Despair. The child begins to accept that the parents are not going to be around. They are sad, apathic, and depressed. Older children may lose interest in activities and food. 3. Detachment. The child begins to adjust and becomes more interested and active in their surroundings. Now we can do Kahoot.
Sorry, waiting.
No problem.
Data is opening the screen, the share.
Okay. Please enter the code and join Kahoot. Anyone? Please join us. Okay, we can do this. We can start this. The patient with prescribed citalopram should be instructed to avoid which of the following: alcohol, all over the counter medications, dark leafy greens, insulin. Answer alcohol. A patient is engaging in therapy that encourages the patient to act out emotional experiences from their past, which dynamic physical therapy, gestalt therapy, psychoanalytic therapy, psychodrama reality therapy. Psychodrama reality therapy. What educational background is required for a nurse to serve as a group psychotherapist? A baccalaureate degree in nursing, a doctorate degree in nursing, a master's degree in health leadership, a master's degree in psychiatric nursing. A master's degree in psychiatric nursing is our answer. Which of the following interventions would the nurse expect for a client with anorexia nervosa? Select 3 answers. A high-calorie diet, administer megastrol acetate, supervised meals, therapy groups. Yes, we have 3 answers. And 5. After discharge from the hospital, the patient develops an intense fear of being alone. This is known as compulsion, obsession, phobia, somatization. It's phobia. Which of the following does not meet the criteria for involuntary admission to a hospital? Select 3 answers. A parent who leaves his child at home alone, a person who is threatening to kill herself, a person who is clinically depressed, a person who is very lonely. We have 3 answers. During which period of a person's life are they most likely to experience separation anxiety? 0, 6 months, 1, 3 years, 3, 5 years, 5, 7 years. One, 3 years. It will be happening. Which of the following situations would meet the criteria for involuntary commitment of a patient? Select 2 answers. Diagnosis of schizophrenia and living alone, leaving one's child home alone 4 days at a time, plans to harm self, threats to kill one's children. Yes. And 9. Which of the following classes of drugs is the most likely to be fatal if a patient overdoses? Antihistamines, benzodiazepines, strictly antidepressants, typical antipsychotics. And last question. The nurse is admitting a patient with severe anxiety. When assessing the patient, the nurse's questions should avoid the open-ended, postponed until the patient has information. Specific, simple, and direct. Now we can learn who wins. And my presentation is done. Thank you for listening to me. If I make a mistake, I'm so sorry. See you next week.
Thank you, Lily.